Welcome to Dementia Air, a content channel devoted solely to exploring topics related to dementia. Dementia Air is a production of Beyond Dementia Coalition, a not-for-profit 501c3 which seeks to reduce stigma and help all of us not only recognize but also accept, assist, and embrace people living with dementia as valued and beloved members of the community. See the person beyond the disease. My name is Bruce Layton, and I'm your Dementia Air podcast host. And joining us today is Carol Hanlon. Carol was an executive director with Bell South, AT&T, as well as a Foreign Service officer with the U.S. Department of State, and focused on the development and implementation of political and economic policy. Carol is currently a Wisdom Keeper and past president of Wisdom Project 2030, and is also currently an appointed member of the Georgia Council on Aging. So, Carol, I was hoping today we could talk a bit about caregiving and put things in the context of caregiving and what it's meant in your own life and your personal experience, and maybe how that shows up in your work in terms of the Georgia Council on Aging. So I'm going to ask you to start by maybe telling us a little bit about yourself.
Sure. My husband, I am a caregiver, and I think that's really my primary role. My husband was diagnosed with Alzheimer's about 5 years ago, maybe a little bit longer. He's very functional with his activities of daily living, but has a lot of short-term memory loss. But we still live, I think, a good and a high-quality life, and we work on doing that. I had to learn a lot about the disease at the beginning and explored all kinds of ways to try to slow it down. So we keep a very good exercise routine. Our diet is very Mediterranean without the wine, unfortunately. And also, adding supplements in there that help strengthen memory and ability to retain. I would say generally we've eaten pretty healthy and stayed pretty active, physically. But the nature of the exercises has changed a little bit. More work with the trainer on things like balance and I guess quick moves, if you will, and then also in core strength, as well as some cardio in there that really improves his heart health, which improves the brain health. We work with a trainer 2 times a week, and we have a set time, a set date. Frequently, so Duncan will start on, he does his cardio first while I'm working with the trainer on my exercises, and then we switch. And he gets finished with his cardio and he's like, that's enough. I don't want to do anymore. So we sometimes have to talk him into continuing on. It's like, oh, she'll go easy on you. Don't worry. You're just going to stretch. And it's usually he comes out of it feeling pretty good.
Yeah. So we just saw the chorus perform here at Cresswind. That's where we're both located, and Duncan's in the chorus. So it's always great to see him out there. And I'm assuming that's an important part also, getting out socially.
Absolutely, yeah. He is a very social person, and he's never met a stranger. He engages people. We were visiting my niece and her husband, and they were really chuckling about the fact that he would go over to other tables and introduce himself and have a conversation with these people, like, well, where are you from? And da-da-da-da. So, but it is an important part of his life, and it really facilitates our ability, I think, to maintain a high quality of living as well.
Yeah, thank you for that. So tell us a little bit about the Georgia Council on Aging and maybe how, as a caregiver, that informs you, and maybe the work at the Council on Aging maybe informs how you approach caregiving. I don't know if it does. I'm asking the question.
Yeah, so I'm a relatively new member. I was appointed July of 2025 by the House Speaker, John Burns. And the council has an annual calendar. So the level of activity has, I would say, multiplied significantly since pretty much the start of the year. And the council, is dedicated to serving older Georgians by advocating on their behalf to enhance their quality of life. So the council is looking to educate, inform, advise on programs and policies that are going to affect older Georgians. And we generally are advising the governor, the General Assembly, so our elected officials, the Department of Human Services as well, and other state agencies that interface with older Georgians. This can, manifest in terms of recommending legislation, presenting testimony at public hearings, training people to be advocates on those issues, and also providing leadership to the coalition of advocates for Georgia's elderly. It's a large group of people, and they are also supporting the work that's advancing quality of life for Georgia's elders.
So it looks like when I go to take a look at the Council on Aging website and kind of how it's organized in terms of hierarchy, there's a long way between where it starts, Health and Human Services, way up somewhere up there, and then the Council on Aging, how it finds its way into the community. So, and I guess my question, touches on you and Duncan in terms of aging in place, and especially with dementia. So I'm going to ask you, and maybe this is a policy question, maybe it's just a fact of life. How important is it for people to have the option to age in place? People that I've talked to, it's often difficult for them to find the dividing line between what's appropriate for in-home and what's available to me, and how do I find the right resources. And then at some point in time, there's often a decision that needs to be made. Do I need to be in another setting? So how do you conduct your life to accommodate the need to, or the desire to age in place? Let's put it that way.
Yeah. And, we are not unusual. We are just part of the majority. Nobody really wants to have to go age somewhere else. And I think, fortunately, there is a continuum of care that's available. So sometimes aging at home isn't really the best decision. Let's say, if Duncan were to pass away and I were to need help with my activities of daily living, assisted living provides me a place where I can get that help, but also continue to stay engaged socially, which is critical. I mean, I think to me, without having that social engagement, aging at home can be a death sentence. So, that choice is important to be there, and the support for it is critical. You need support, obviously, from your family. They have to understand what the situation is. Looking at other resources in the community. The question, part of what you've asked me is where do you look? So every county here in Georgia is covered by what's called a AAA, the Area Agency on Aging. They are the recipients, I would say, of federal and state funding to provide many support programs for people who are still living at home, as well as advice and information really about the other opportunities on the continuum of care. So whether that would be an assisted living facility or nursing homes, they are also involved in helping guide you through the process of making those choices. So our AAA here, Legacy Link, covers a lot of different areas. Meals on Wheels, it's home and community-based healthcare. So there are classes, there are helping you link you with caregivers, that sort of thing.
Yeah. What kind of financial support is available? I heard you talk about you have a trainer that comes in. I'm assuming there might be other needs, maybe now or eventually. I'm trying to think about financial support because I hear so often, again, stories that I hear, it's really difficult. You might find the resource, but it costs something. So tell me, can you expound on that just a little bit?
Yeah, so I actually just learned about that. There is a way that you can get a stipend up to almost $2,000 a month to help for caregivers that are like me. I'm giving care to my husband. I don't know what the eligibility requirements are. I'm sure they're income-based, but I do know that there is a stipend out there to help family members who have, or I should say, maybe not family members, people who have sort of left the work environment, the formal work environment, to become a caregiver. So I know that resource is out there. There are many other programs like Meals on Wheels where you can have food delivered. There are transportation services. Those are all out there. They take time and effort to find.
So speak to that, time and effort to find. There's just, so who do you call? Do we go to Legacy Link? Can they connect me with everybody?
Legacy Link, I think, is in that menu, right? I also think AARP. This is, I think, part of the challenge of then becoming a caregiver is you also have to continue to educate yourself as you go along. Some things are relevant, early on, and some things become relevant as the disease progresses. So trying to wade through the volume of information that's out there, finding those agencies is sometimes challenging. I mean, if you're being challenged at home with just delivering the care, the time and effort to put into learning, other resources can be really overwhelming. And I kind of look at it, I mean, I went through a lot of the clinical trials and that sort of stuff about what can I do lifestyle-wise to keep his memory intact as long as possible. That took a lot of time and effort. We aren't too challenged with the activities of daily living. So I just had this conversation with my niece, and I said, part of the challenge, I said, is I am exhausted right now because we're going through a health issue. It's affecting both of our sleep. And I said, people are offering to help, but I said, I can't figure out what it is I should ask for help with. That's a big challenge for me. And she suggested, which I haven't done yet, but I am going to do, is to go on AI and see if AI has some suggestions, sort of outline where he is, outline the sorts of things that I do, and then throw into that mix. Gee, if I had more time, how would I spend it?
Interesting. Tell me about the clinical trials. How did you make your way? Was Duncan in a clinical trial, or?
He was, yes.
Yeah.
I'm trying to remember the genesis of that. I think I heard them speak at probably an education event here at Crestwind. And we're pretty lucky here in Gainesville to have a clinical trial facility located here. And their trials are focused on issues that are pretty important to people of our age group, things like diabetes and especially dementia. So sorry, go ahead.
Did you want to mention the organization?
Sure. Yeah, the Center for Advanced Research and Education, CARE. So I think I started maybe by submitting my name. And then anyway, as we went along, we learned of other trials. So Duncan participated in one that has not yet come to the commercial market, but showed very good signs of slowing the progression of plaque accumulation in the brain. And there are several other drugs, some of which have now come to market. The one where, I've forgotten the name of it, but where you go and you have an infusion every month. There's some others that are now being developed as pills. Some are shots that are being given.
And is that something that Duncan would participate in, or?
We were all set to participate in one called the Brain Shuttle, which basically carried plaque removers through the blood-brain barrier. So it would cross that, and then the medicine would work in the brain, remove the plaque.
Oh, remove the plaque, wow.
Yeah, remove the plaque. I know, fantastic, wouldn't it be, just to be able to revert, not just stay where you are, but reverse. Yeah. And we were all set. We were in the evaluation phases of that, and he had an eye stroke. And apparently, while there was no real damage to his brain, he's lost vision in that eye. But there's something in the trial where maybe there's greater risk to eye damage or something from the drug that disqualified him.
Got it.
So we have left his name on, and they know us, left his name on the list over there. So if they've got something else that comes up in the future and he's eligible for it, we will definitely engage.
Thank you for sharing that. So let's talk about, from a policy standpoint, meaningful alternatives to institutional care. So many people struggle with institutional care and what that means from an assisted living facility or skilled nursing, whatever the case might be. And it's, what are the alternatives? And I know you've worked on a couple of projects independent of your current position through Wisdom Project and whatnot. So maybe you can speak to that. What goes on, and how do we How do we work through that?
Yeah, I think, as I said before, I think we're very lucky we have a suite or a continuum of care that we can look at. So while many of us may prefer to stay at home, bringing in help as we need it, in some cases, that's really not the best choice. And it's, in some cases, absolutely not a good choice. I have a good example of actually, I think, of why a move sometimes to assisted living is better. I have a friend who has dementia, and her husband had kidney failure. So he was actually getting dialysis 3 times a week. My friend is very social. She's always been very social. But her husband, with the dialysis, was too weak to be able to continue to engage outside of the house after the treatments. So they basically became homebound. And I would have said she was a prisoner in her own home. And there was nobody coming in to do anything. So little or no chance of engagement except with her husband, who was probably sleeping a lot after his treatments. They would have benefited, I think, greatly to be in assisted living. What happened with her is eventually he finally did hire somebody to come in to help him with his dialysis, and she was spending all of her time in bed, basically curled up in the fetal position. At some point, the caregiver said she's reaching the final stages of Alzheimer's. And so he agreed that she could go to a memory care facility. She got there and she started chatting with people, engaging in different things. Right now, her husband has since passed. Her daughter has moved her to another place near where she lives. And she is laughing again, talking, engaging.
Wow.
Yeah, I know. Grasped from the jaws of death there, I think.
Yeah.
And I think, people don't think about that. It's like I want to stay in my own home. My things are here. But you have to have all those elements. You've got to have health care. If you need help with just living daily, food, for example, so no one was cooking at their house. There are those things you can take off the plate. Mm-hmm. And then use what energy you have left to do the things that you really enjoy. So that's kind of the middle ground, I think.
I love it. Thank you for that. Mm-hmm. One last question for you, and that goes to the caregiver and respite for the caregiver. So I saw a number of recommendations in the study that Pamela Elfenbein at UNG did, and it was pretty interesting in terms of improvements that could be made to some of the agencies in the way they work with the public and make things available to the public. And just, it doesn't seem, I'm not aware of anything in Gainesville specifically where we are, where there's person-centered care for dementia specifically, where they understand the person that's living with dementia and what their needs are and what their preferences are. Are you aware of anything, and where do you go to find something like that?
It's a good question. Not to my knowledge. We used to have a place that was called the Guest House, and that closed. And there is a discussion currently underway, a proposal actually, if it gets funded, that I think could bring back something, perhaps not a 5-day-a-week location for people to come to, but at least a place where once a week you might be able to be able to drop them off. And I think you and I talked about this previously with Duncan, what I worry about is a separation anxiety. So he's, as I said, very friendly. One of our neighbors has kindly offered to take him when he goes to volunteer at the food bank, and he takes him with and stuff. But Duncan, once he gets there, he's fine. He fits in and everything. But one of the challenges is if at some point he's like, "Where's Carol? Where's Carol?" Mm-hmm. And if that gets out of control, then what do they do? And that's a big burden to put on someone else who's kindly helping you out. So with a respite care program, I will be looking for something where they can meet us at the door and that handoff becomes smooth and he doesn't worry about where am I, where is he, that sort of thing.
And you said there's a proposal.
There is. It's going to be, if it's funded, it's going to be through the senior center.
Oh.
And they're going to use that on Saturdays because it's used Monday to Friday now, and it'll be available on Saturdays.
Yeah.
So it'll be a pilot program. I don't know what the timing was on the grant. I know the grant went in earlier this month or last month, and then we'll see. I don't know how long it'll be before they hear if they get the grant or not. Yeah, so keep your fingers crossed on that.
Thank you for that. And I'm assuming we don't need to talk about it today, but as I did my research, there is a dizzying array of services available in-home services through the home and community-based services, through I think it's the Council on Aging, and through the area agencies on aging, as you said. So it looks like respite care is a part of that, where it's actually available in the home. So maybe that changes kind of the dynamics of having to take somebody out of something they're familiar with and into the wild, so to speak. So great discussion, Carol. I'm trying to summarize so we can...
Okay, because I talked about the assisted living, but I didn't talk about long-term care.
Go ahead.
All right. I'd just like to say a few things about that, because I think this country overall is really suffering on the long-term care end of things. We have a situation where people would rather die than go to a nursing home. Despite, I would say, the best intentions of many nursing home operators, the quality of care really it suffers. And part of that is because the way the model was developed back in the 60s, let's say, is they used a hospital model, which basically treats someone who's older and needs physical or mental care as a patient and not as a person. And so you get long hallways. Many nursing homes look like a hospital. They have a nurse's station. They have these long hallways. They have very clinical looking rooms where you live in with hospital beds and all that sort of thing. There are a lot of things that can be done physically to change that look and feel. And I think that carries over mentally into how people then are going to deliver care as well. If you think about, first of all, having a private room versus a shared room, well, let's start with the number one health issue, which is infection control. And COVID certainly proved that out. You know, the number of deaths among people in nursing homes was it was huge. It was outrageous is what it really was, because they were in shared rooms. But with private rooms and private bathrooms, you immediately start to lay down dignity for that elder. Sometimes, if you think about it, in a nursing home, if you walk through, you can see the beds as you walk past the door. Well, where is that person's privacy, right? Why can't that bed be shifted so that it's not visible from the doorway? So when they're getting in and out of bed in their pajamas or whatever, they have a bit of privacy there. There are things like controlling the lights, lighting coming from the hallway, lighting in the room, and also noise. That's the other thing, controlling the noise in your room. If you need quiet to sleep, then all of the chit-chat in the hallway, or if they have a loudspeaker system calling this or that. If you've ever spent a night in a hospital, it's similar. Yeah. There's no concern for the person in the bed, and this is their home. That's the difference. It's not a 3-night stay. They're there for the remainder probably of their life.
Thank you for that. It's interesting. We could get into a whole discussion about value and quality of care and what that really means. I think you've just started to touch on the surface. If it could be a much longer discussion. And there are a number of constraints out there, aren't there, in terms of alternative settings? So retrofitting someplace that's existing, to my mind, unlikely to happen, really.
I think there are paths, so one thing I think we have to acknowledge is that because this was the formula that was used, those buildings still exist, most of them. And so that makes them more than 25 years old for sure, right? So they have been laid out in a certain way. It doesn't mean, however, that you can't creatively find ways to create smaller homes within the larger home. So you can actually create neighborhoods. And if you assign a care team to a neighborhood, they're working with the same people all the time. So they're going to know, Bruce, if you look like you're not fully awake or you're sleeping more than you normally would. They're going to notice those physical changes, and that has to change the way they give you care then. You can't look at that and say, oh, he's fine, Yeah. No, there's a difference there. And they get to know you more personally and vice versa. And that personal relationship also changes the care.
Thank you for that thought. That had not occurred to me. I've been thinking of alternatives and alternative programs, and the concept of neighborhood within a home or a community is important. So I'm going to summarize. Tell me and help me out here. I heard, number one, we spoke about connecting the dots and how difficult that might be, and that you're shifting to maybe let's consult with AI, the AI bots. So there's the connecting the dots using AI for that. We spoke about quality of life and some of the aspects around that, and characterized maybe the shift between being in the home and then finding in the continuum of care, maybe an assisted living facility as an option at some point in time for a variety of reasons we spoke about. And then you just opened my eyes to thinking about long-term care and the institutions that exist and the possibility of changing them without anything that's beyond the stretch of the imagination, right?
Yep.
Does that make sense? Okay.
Yep.
Carol, thank you for that. Thank you for being with us today. And
thanks for having me.
We'll talk to you soon.
I appreciate it. Nice speaking with you.
Beyond Dementia Coalition is on a quest to close the dementia preparedness gap we face. To get there, we sure could use your support as a donor or a volunteer. To get involved, please go to beyonddementiacoalition.org. All donations are tax deductible, and be sure to subscribe to our mailing list to receive our monthly newsletter in your inbox, where we'll share new podcasts, fact sheets, webinars, blogs, and other dementia-related content. This is Dementia Air. See the person beyond the disease.